Talk more about the plight of health workers during this COVID-19 pandemic. I'm joined by Josias Naidoo. He is the Gauteng chairperson of the National Healthcare Professionals Association. He's joining us by Skype this afternoon. Josias, a very good afternoon to you. Thank you so much for your time. So your association has been quite angered in particular by the allegations of corruption linked to PPE procurement, so much so you've even put together a video of some of your colleagues who've died on the front line.
Yes, Thembekile, it's been disappointing to note that so many lives have been lost by something that we could have prevented had people had proper access to PPEs, and that corruption hadn't watered down what we could do with the funds that we have.
And I was speaking earlier to Nehau about just the definition or determination of the circumstances of a healthcare worker becoming infected with COVID-19, given that, yes, a lot of them, or some of them, are facing these PPE troubles, yet they also go out into communities where the virus is indeed spreading. So how do we begin to get an accurate enough picture of just how health workers are becoming infected?
Unfortunately, we're going to have to look at the demographics. We're going to have to look at whether those health professionals contracted the infection while under the employment of the Department of Health, whether they were within the private sector, and then, as you pointed out, whether they actually picked it up in the community going about their daily activities. But from the reports that we've received from members that we've interacted with, we find that many people have had been requested by the Department of Health to use PPEs or to use some of their masks for an extended period of time. We're aware of interns who've been asked to use a mask for a period of at least 1 week before changing. So those are the risks that we need to identify. Those are the risks that we need to try and find a way to contain and manage, so that we don't end up in a situation where more health professionals are compromised.
Let me ask you then, Josias, about the extent of the PPE problem to your knowledge. Excuse me.
So it's a twofold issue. I think people focus on what's happening in the state and the corruption amongst the tenderpreneurs, but in the private sector there's also a huge shortage of PPEs purely because we've got a number of individuals who have stockpiled and they're trying to drive the prices up unfairly, and placing unnecessary restrictions on people trying to access PPEs. So if you're an individual practitioner, you're not able to buy 20 or 30 masks because somebody has a stock of masks and they're expecting a minimum order of 100,000 or so. And that makes it very, very difficult for people to easily access in the private sector. In the public sector, it's a whole different ballgame. We've seen cases where masks have been inflated by 300–400%, and the state willingly bought it. So, yes, there are instances where the state can confidently say they have secured the purchase of masks, but they could have bought 3, maybe 4 times the quantity with the same amount of money had they done proper due diligence and proper planning in terms of their procurement processes. And then we've also had issues of crime where we've seen on the news people have been robbed, warehouses have been raided, trucks have been hijacked, and PPE that was destined for practitioners or destined for the state facilities have been removed by criminal elements.
Josias, are hospitals, public and private, being honest about the extent of the PPE shortages, do you think?
No, because what we hear through official notices and through official channels is that the Department of Health and the hospitals have secured sufficient PPEs and that they have channels in which people can procure and request for their clinics or for their departments. But on a daily basis, we're aware of practitioners who request support from NPOs and outside parties because they do not have access to these supposed stock that the government has promised. We've recently had a call from a big hospital in Johannesburg where there's approximately 200 doctors who say that they can't access or they can't source coveralls for work purposes. And the state will go on record and say that we have sufficient PPEs and it's the doctor's responsibility to find it. So maybe there is, but the state needs to clarify to the frontline workers exactly how to access these stocks and what the process is to ensure that there's never a shortage.
Away from PPE, there's been an idea about paying health workers in the country a certain sum or whatever amount for danger pay, because this is quite dangerous work that you're doing currently. Are you on board with those calls? And if yes, what would be a sufficient amount?
But we can't put an amount to the risk that this specific pandemic is placing. But in most government departments, if you work with the police, if you work with certain other entities, and you are faced with danger in the line of duty, there is compensation. And I think it would be fair that our nurses, our health professionals that are on the front line are actually given some form of compensation for the risk that they're facing at this point in time.
Now is floating the withdrawal of labour if PPE concerns and the related corruption are not adequately addressed, for instance. Would you be on board with that call?
Again, it's a difficult situation because in many cases, frontline workers make the difference between patients living and dying. So yes, we support the need for some form of mobilization, some form of action, some form of event that highlights the fact that the government needs to take care of our health workers. But just to blanket say that everybody needs to down tools and stay away may be a little bit risky at this point in time, considering that we already have health facilities that are understaffed and under-resourced. So yeah, I think it's about time that the Department of Health engages
All right, let's leave it there, Josias, because we're battling with that Skype line somewhat. Josias is with the National Healthcare Professionals Association. He's part of the Gauteng leadership. Still to come.